Hi, I'm Dr. Bill Coleman. Among the thousands and thousands of patients we've treated with liposuction, there have always been patients who've been concerned about other things other than just localized areas of fat. Often as people age, their skin gets a little looser around these localized areas of fat, and sometimes they develop cellulite. Cellulite is not only seen in people who have overweight situations, but also seen often in very thin, fit people. So there's many aspects to deciding what to do about cellulite and what to do about excess fat. You may have seen that there's lots of new techniques for working on excess fat nowadays, but the technique that still remains the gold standard is liposuction. We do all the other techniques. We've often been the one doing the research on them after all. We use the various energy-based devices, cool sculpting, but we also do lots and lots of liposuction still. You might ask why. The reason is because you get the best results from liposuction. It's a one-time procedure with one-day recovery, local anesthesia. You can be back on your feet or fly out the next day, and you will get a far better result from that than using any other approach. If you're interested in just small areas, sometimes we can use the energy-based devices such as UltraShape, which is a really great way of sculpting small areas, or Kybella, which is an injection which can go into small areas of fat all over the body, or cool sculpting, which you may have heard about for small areas. For larger areas, liposuction is still the king, however. And then there's cellulite. Cellulite really has nothing to do with fat. Cellulite is kind of like a mattress where the skin is pulled down by those little buttons that you see in your mattress. In this case, in the skin, these are little tethers that extend far down into the tissue. If those feathers are cut or laced, it allows the skin to pull up and you get a smoother appearance to your skin. We have a number of techniques that have been useful for this, including a device called Selfina, which actually cuts these little bands. But sometimes we also use tightening lasers in conjunction with these surgical procedures to tighten skin as well as to release these bands or to get rid of fat. So you see, getting rid of fat and cellulite is much more complex than you might think, and you need an experienced doctor to make decisions about what the best thing is for you. Because after all, a custom approach that's designed just for you is the best approach of all.